foundation of physical medicine rehabilitation lies in the idea that we're going to restore function and optimize performance in somebody who has been injured or is hurting. And there's a lot of methods to doing that. But typically we focus on the muscles, the nerves, and the bones and the joints and try to piece that back together again. We're also known as physiatrists. That's what you would call somebody who's a physical medicine and rehabilitation specialist. You really focus on the diagnosis. A very strong physical exam, diagnostics, and putting all these pieces together to get a clean diagnosis is really important because sometimes pain could be coming from several different areas. Some of the more common conditions that I treat involve the musculoskeletal system, and I have an interest in treating spinal conditions, whether that's the neck, the middle back, or the low back. And that would include things like herniated discs, arthritis of the spine, curvatures of the spine, and sometimes these conditions manifest as pain. I think a common misconception to a lot of people is there's no in-betweens. You either live with it or you have to go have surgery. And our field allows for those in-betweens. We can find a good rehabilitation program, sometimes the right kind of medication, or a non-surgical procedure that could help you get past your painful back. There's some really interesting treatments in my practice, and a couple in particular that are really appealing to me and that have been very, very helpful for patients is when we use electricity in our procedure suite. And there's a couple of ways we can do that. One of them is something called radiofrequency neurotomy or ablation. And we can take a very small directed amount of electricity and place it on top of a painful nerve and lesion it, or ablate it, or render it unable to send a pain signal. And by doing that, you can break free of some of your pain. And there's another treatment where we use electricity, and it's called spinal cord stimulation. We can take a little wire that has electrodes on it and place it inside of the spinal canal and block people's pain signals. My patients might be surprised that I've been a patient myself. I tore my meniscus while running, and I sought the care of another fellow physiatrist. We got a diagnosis. I went through a treatment plan, which included physical therapy, modifying my activity. I got an injection, and I actually recovered fully, enough so that that same year I was able to run a marathon. So it's really nice to be a patient and be part of the process, and it gives you more faith and lets you believe in what you practice.